Thanks everyone for accepting that. Next slide. So we've all got lots of different hats, but with my IUCN World Commission on Protected Areas hat on, so Robin and I chair a group of practitioners who are really interested in this space, and they're people from around 20 different countries, around 50 active members who come together a few times a year to talk about the health and wellbeing benefits of time spent in nature and protected areas. So essentially what we're trying to do is build the knowledge around this area and mainstream that across different sectors, and then bring those sectors together, facilitate partnerships at various levels to really influence policies, plans, and programs. So next slide, please. IUCN events are fantastic for building on that work, and this slide shows a really solid outcome of the last IUCN World Conservation Congress we had, which produced this Nature is Good Medicine call to action, which is an 11-point plan for practitioners from various sectors who are really interested in this work. Next slide, please. However, a really interesting milestone event happened in 2017 in Melbourne, not at a conservation congress, but at a public health congress, and that was the 15th World Congress on Public Health. And there we brought together, I believe for the first time in the context of a public health event, the International Union for the Conservation of Nature and the World Health Organization to discuss this very topic. And essentially we heard one thing that was quite surprising to some of us from the environment sector, which was that public health practitioners really emphasised the need for leadership from the environmental sector for therapeutic interventions. That was quite a shock to us. And this discussion, we hope, will unpack a little bit of that. Next slide, please. So this panel is to discuss exactly that. Who should do what? Who should lead? Who should follow? Where should we all position ourselves in this very emerging field of nature prescriptions, particularly here in Australia? So with the wealth of experience around the panel discussion table, we really want to uncover what some of the barriers are to uptake here in Australia. And we want to work out how best to progress nature prescriptions and what are the different ways forward for us to do that. So on that, I will now hand over to you, Robin.
Thanks, Jo. Next slide, please, Jose. I'm just going to give an overview of what nature prescriptions are, just in case people aren't aware, before we start the panel. So a nature prescription, they're also called green prescriptions or green social prescriptions. It's when a health professional provides written advice to a patient to spend time in nature. There's a lot of demonstrated benefits for nature prescriptions, such as reduced stress, blood pressure, depression, improved healing and resilience. And they're widely used throughout the world. At least 9 countries are using them, but there's been little uptake in Australia. In Australia, social prescriptions have just started taking off, where a health professional prescribes social activities to a patient, but still green prescriptions, nature prescriptions are lagging behind. And the reasons why it's been so slow to uptake in Australia is not clear, but it could be that we don't have a organisation that sits above all the sectors. So, for example, in the UK, they have a body that sits above the health and environment sector that brings them together, which could be one of the reasons. Next slide, please. And so nature prescriptions take different forms wherever they're used. For example, in the US, where they originated with the ParkRx program, that was an early adopter of nature prescriptions. The GP sits down with the patient and prescribes contact with nature on a one-to-one basis. The GP looks at where the person's local park is and will set a prescription, for example, spending 3 days a week, 20 minutes at a time at your local park. And then they've also developed an app that monitors whether the patient has done it. In the UK, they tend to use link workers. So GP prescribes the patient to connect in with a link worker, and then the link worker meets with the person and works out a plan that works best for the person. In Canada, recently, park prescriptions have been really successful, where GPs are handing out free park passes to certain patients that would benefit from that. In South Australia, we ran a nature prescription trial a few years ago. We partnered with Appleton Institute, and I'll just give a brief overview of that. Next slide, please, Jose. Just as an example of how a nature prescription program could be run. We chose to do a program that was as cost effective as possible, that was linking into existing environmental activities that were already happening. And we wanted to do it as cost effective as possible in case it got scaled up across the state. So we ran an 8-week free program, 2-hour sessions each week, with the goal of reducing barriers to connecting to nature, providing people with the skills and the motivation to connect to nature. And we had a focus on connecting people to their local green space rather than taking them off to somewhere outside their local area, so that the gains could be maintained after the 8-week course. We did surveys at the start and the end. It was part of a research trial to look at how effective the trial was. It was only a small trial. It was a few years ago when nature prescriptions were quite foreign, and we didn't get a lot of people prepared to be part of this initial research trial. But it gave some good information on the barriers to people participating in nature prescriptions. It was also a really good tool because it demonstrated that there's a lot of environmental agencies out there and councils that are willing and able to connect in with a nature prescription program. So we had about 17 different environmental and council agencies across the sector wanting to participate that were involved, and we had individual GPs wanting to be involved, but that we hadn't yet engaging the health sector at the time didn't work so well. And we're just going to show a quick video that sums that up, and then we'll move into the panel discussion. Thanks, Jose.
How can spending time in nature help a person's health and well-being? We are supporting GPs, psychologists and other clinicians to conduct a program called Nature Prescriptions. And here, individuals will be spending time in nature and undertaking a wide range of activities to see how that might improve their mental and physical well-being.
We stand everything to gain from these nature prescriptions, and we're lucky in South Australia that we have so many wonderful green spaces that people could be utilising more. So I think nature is very important for people's mental health and physical well-being.
We thought it was important to demonstrate how a nature prescription trial could operate, because they're widely used overseas, that nature prescriptions and social prescriptions, but they're used very little in Australia, and we know that they work. People are reporting benefits, and at Green Adelaide we know that the more people connect to nature, the more they value it.
I think I've been able to be more mindful of the ways I can connect with nature. That's the main difference.
I'm already thinking about a lot of things I'm going to go out and do now. Go and spend some time out barefoot in nature, at the beach for example, and hopefully doing things like planting trees and getting my hands in the soil more. I've already started to grow some succulents around my backyard and in the house.
I still haven't carved out enough time to do the things I thought I would like to do, but I'm able to be more mindful of the ways I can connect with nature on a daily basis, and the little things count. It's not just, I need to get out in nature for a day. I can spend 5 minutes in the garden.
Australia is actually the most urbanised country in the world, and arguably we get out into nature less than many, many other people in the world. So as an alternative intervention, as a better way of doing it than drugs or sitting in a room talking to somebody, I suspect it's both cheaper and more effective. But it's a new therapy, and as with all new therapies, there are a lot of resistance to entry. There are barriers that people have, and part of the challenge in this program is to work out how do you do it in Australia for Australians.
So one thing I got out of it was learning how to be better at self-care.
Thanks, Jose. Yes, that didn't work so well, but not to worry. But if people want to see the video or the technical report, it's on the Green Adelaide website. So we'll move into the panel discussion. And we've got a great panel today. We're representing all the different sectors. We've got the environment sector, we've got the health sector, research and GP practitioner sector. So I'm going to start with Thomas first. Thomas, from a research perspective, is there a demonstrated need for nature prescriptions in Australia, and is there good evidence for their benefits?
Thanks, Robin. Good to be with you, and good to be with this esteemed panel. And hello to everyone at home and at work. I'm coming to you today from Gadigal Lounge from the University of Sydney's School of Architecture, Design and Planning. And may I say also a happy Lunar New Year for everyone who is celebrating this important event for billions of people around the world. Is there a need for nature prescriptions? Well, yes. Global burden of disease studies for the last 20 years have shown that we are still in the hole, in the ground, with regards to trying to deal with huge challenges like depression, diabetes, dementia, physical inactivity, heart disease. And this is not just in Australia, but around the world. And now we're increasingly recognizing that loneliness is a major risk factor too. Just last year, the World Health Organization cited evidence saying feeling lonely persistently increases our risks of, feeling miserable and also putting us in an early grave. So apart from that, it's all going fine. Clearly, we need to do more on that though. Thousands of studies, including some that I've led, indicate that contact with nature can help to reduce onset of many of the health problems I've listed already. For example, work led by Professor Xiaoqi Feng, and I was involved, showed that during the COVID pandemic, the odds of keeping connected with neighbors and leading a very fulfilling and meaningful socially connected life increases 5 times for people who have good quality green spaces nearby. In another study that I led, the odds of becoming lonely over time halve among people living alone who have good amount of parkland nearby. Now, for everyone who's on the call and everyone who watches this later, you'll be familiar with the great philosophers Monty Python, who will probably describe this as a statement of the bleeding obvious. But newsflash, 1 in 3 Australian adults spend less than 2 hours a week in any form of nature. Our beautiful beaches, the wonderful mountains, the great lakes and parks and all the rest of it, less than 2 hours a week, only 1 in 3 adults. Good news, good news. Over 4 in 5 adults say if they were offered a nature prescription from a health professional, they would welcome one. 4 in 5, 80%. So, evidence from our meta-analysis, which is basically just collecting all of the studies that have been done around the world and pushing them into a statistical model and seeing what spits out the other side, shows that having nature prescriptions on average helps to reduce levels of depression, helps to reduce levels of anxiety, helps to reduce levels of high blood pressure, and also gets us out walking. Evidence around keeping more physically active, the sort of activity that helps you puff and pant and get the heart racing, that's yet to be established a little bit more. And that's why I, and with Professor Rena Ivers on the call and many others around the world, are leading the physical activity in nature, the PANDA trial, over time to see what we can do about that. So in sum, there's a big need, obviously, there's big interest, as shown by our work in Australia and similar studies around the world. And because of this meta-analysis of great efforts being done by previous studies and also the ones that we're doing now, there's big benefits of prescribing time in nature too. So really the question here is, why aren't we?
Thanks, Thomas. Drew, from a health perspective, why do we need nature prescriptions and not just provide a whole lot of nature-based health activities like bushwalking? What's the benefit of medicalising contact with nature?
Look, it's a real. First of all, great to be here, and I'm calling or talking from Paramount Country in South Australia. It's a really challenging question, and I think while the benefits of being in nature are or have been very well rehearsed for many years, I come from a psychology background, and we know that there is all sorts of things that everybody knows is good for people's health, both at the individual and public health level. So eat well, get a good night's sleep, be physically active, spend time in nature. The challenge is if you say to people, would you like to spend more time in nature? As Thomas has told us, 80% of people say yes. If you say, what would you be prepared to give up in order to spend that time in nature? Probably the same 80% of people say, well, nothing actually. So it's this great challenge that public health practitioners have had in many domains over many years, is that we know it's good for us, but we don't do it. And I think there lies the challenge for this in the healthcare sector. I think the other big challenge is that the health industry needs to be able to monetize nature prescriptions, because if you can't make money out of it, it's going to be unprofitable for practitioners, clinicians, and those kind of people. So I think working out how it can be monetized in a reasonable and ethical way is going to be really important. But my particular interest has been around understanding what people think being in nature means to them. And with a bunch of anthropologists recently, we spent a lot of time talking to Australians about what does being in nature mean. And one of the interesting misunderstandings that the Australian public have is that for most Australians, when you say spend time in nature, in their mind, it means an expedition. It means getting in a car, driving to somewhere remote, having a camping set up and all of those kind of things. And the time taken to do it takes days, if not weeks. This idea of just zipping down to the park isn't always seen in the same way as many of the people working in the field do. So I think the big challenge is that at the moment there is a lot of do-goodery going on. That is, people know it's the right thing to do and we all do it, but if you've drunk the Kool-Aid, you often forget to understand it from the perspective of the people who don't understand it. So I think we need to do a lot more to understand what will motivate people, what people think being in nature is, and how we can get practitioners to engage in behaviours that promote it. So, for example, at a really practical level, in Australia, if you are a clinical psychologist delivering care under the Medicare system, which reimburses the patients for it, you can't actually do it outside of your office because you're reimbursed to provide that care at an address. And it's technically illegal to take somebody out into the bush to do that same process. So there are a lot of those simple structural problems that we need to address. So while I agree that it's a fantastic thing to do, we need a much more nuanced understanding of how to make it happen. Just telling people it's good for them, as with many other things in life, doesn't always work very effectively. Back to you, Robin.
Thanks, Drew. Rowena, as a GP, your perspective on nature prescriptions, is there any benefits to them, and are they widely accepted by GPs now?
Thanks, Robin. Look, and as a general practitioner or family physician, We work with people across the whole of their life, from birth right through to end of life, and palliative care. So, but of course we work with a lot of people with chronic diseases, and we work with people with mental health conditions, and also we've got a big role in prevention as well. So absolutely part of it. So look, there's some really practical ways that I think that, and the family general practice team. So I actually work with psychologists, nurses, Aboriginal health practitioners, a range of other practitioners. So yeah, so there's some quite practical things that we can do. And the first thing is obviously talk to people about it. And I guess in primary care, we get to know the community, we get to know people very well, because we've often known them for many years. So it's actually, from the evidence, it's also really important to have activities that suit that person. So an old person with dementia might like to do something like gardening in their care home. For someone like a toddler, it might be a nature-based preschool. For a middle-aged person, it might be park run. Or joining a bushwalking club. So there's it's really about things that are accessible, close geographically, financially accessible, and that give people the support. I think there are always a small number of people who need really more support to get organised and even to get there. So in Australia, we've got a few techniques for really, we actually in the past have used written scripts, didn't really work that well for exercise. So really now it's about that conversation, but we often will document them in chronic disease care plans. So for someone with diabetes, for someone with mental health, we do a mental health care plan. Might actually document that and do planning with them about, and, planning over time as well to see how they're going. So for, we do have, in Australia, we have the National Disability Insurance Scheme. And even this week, I've seen a couple of people who come in with their caseworker. And for, say, a young person with an intellectual disability, an older person, say, with something like Down syndrome, it might actually mean that some of their activities are going bushwalking. Or I'm thinking of someone with autism who's doing some disability work in a community garden. So there's ways that, we can recommend. It's also important to have that support from the community organisations as well. So, but it's really about tailoring it to that person. I think link workers is a great idea. I think in where I live in Wollongong, we have our local primary health network, which is the regional health organisation, has link workers funded through a special grant. We can get link workers to organise activities and assist them. And I guess for people who just aren't going to make that phone call, they're not going to go down and go for the first time by themselves to an activity, they can help them with that. I think the other thing that really helps is just guidelines. We have online guidelines. We actually really, we call health pathways, which are local guidelines for all health practitioners, where you can then actually look at activities that might be suitable for people for social prescribing. So we actually use the council websites as well, especially and in some circumstances they've got discounts for pensioners for some of the activities as well, or free activities. So but yeah, I think a lot of people aren't aware of it. I think a lot of GPs might do it without knowing that they're doing it, but I think there's definitely a lot more scope for supporting people into activities that are targeted to them.
Thanks, Rowena. And Joe, from an environmental perspective, what are the benefits of nature prescriptions for conservation? And do we need prescriptions, or can we just have a whole lot of activities in a park?
Well, there's a myriad of benefits. It's like Parks Victoria's Healthy Parks, Healthy People approach to managing parks. You can't have one without the other. Human health is integrally dependent on the health of the environment. So what are the benefits for the conservation or park management sector? There's many, but what we do know, evidence and research has shown this over time, that if people are connected to nature, they become more, they care about it more. But the key is, and this somewhat goes to answering perhaps Drew's question he posed about you know, how do we get people into their local park as opposed to just thinking it has to be this big camping expedition. It is making these local parks relevant to their local communities. So one of the benefits of nature prescriptions in this medicalised context is that it often enables people from non-traditional communities or non-traditional users of parks to have a pathway through to parks. And from that comes a number of benefits, not only for the park agency, but for the people as well. So there's these byproducts, such as people create this new relationship with nature, be it their local park or be it a big, national park. But more often than not, it is in the context of an urban setting. So these smaller urban parks are very important as this gateway for people. People can learn new skills through being involved in a nature prescriptions program, depending on the activity. And that in turn then assists park managers, because people can volunteer and do all sorts of things to work alongside park managers to help with conservation efforts. I think it's important, though, to emphasise that nature prescriptions probably aren't just to be seen as a walk in a park. So they need to be with clear health goals as well for the participants. And the script then needs to identify things that will help their health. And park managers are very, very keen to work alongside the medical sector in this way. And I'll just give one example of a program that we are running in Parks Victoria, which is funded by Vic Health, so the State of Victoria's health promotion agency. And we work in partnership with Outdoors Victoria. There's 3 of us working together to get 600 disadvantaged kids out into parks in the next 6 months for their health and well-being. And the series of evaluation around that program is already showing that this is a fantastic opportunity. It's sort of like a nature prescription, but without the doctor. So Rowena, I've got a job for you. Thanks, Robin.
Thanks, Jo. And so a question for the panel, anyone can answer. If nature prescriptions, we need them, there are benefits for them, why, and they're operational around the world, why have they been so slow to take off in Australia? What are the challenges? Thomas.
Thanks. By the way, this panel is great. I've been enjoying and listening to and learning so much from my fellow panelists. One person who I would like to raise to the audience here is called Dr. Kasia Olsen. She's a mentee of mine based at the University of Wollongong and also a co-investigator on the Panda trial. She's been looking at some of these issues for the last few years. So she works in mental health care settings from a social work perspective. And she's looked at institutional factors and found, there's a variety of things. There's a lot of goodwill and desire among mental health professionals to promote nature prescriptions and even organize nature prescription related activities. Indeed, you can probably guess many of these individuals actually have getting outdoors into nature as part of their lifestyle. So while the evidence of nature prescriptions being good is fantastic, they already kind of intimately know there's a benefit to this and they would like to share that. However, there are a few issues here that need to be addressed. The first is that there's a lot of barriers. There's perceptions among many mental health professionals, this might go to other health professionals too, that many people will have anxiety about even spending time outdoors in settings which they haven't spent much time in before. They're not familiar, they've grown up in places which don't have good quality parks or beaches or mountains or whatever it is. They've lived a life so far which has been almost disconnected and absent of the great outdoors. So changing that now, like switching on a light bulb, is not going to be easy. There is the obvious, which is a lack of geographic access, which if a person lived in that type of circumstances for the last few years. Why is that suddenly going to change now? But this is specifically relevant in particular for individuals living with disability, where there's lots of studies now showing that many people with disability know getting outdoors would probably be good, but they can't. There's no good paths to get into the local parks nearby. And these places become, rather than sources of restoration, they become more misery because one feels deprived from a lack of urban design that's inclusive and enabling. Finally, to put a bow on this, there's organizational factors with relevance to safety risk, perceptions of, for example, what do I do if a person falls? What do I do if a person on the activity becomes unwell? Are people able to actually complete a long walk in nature without any of these misadventures occurring? This is just, the tip of the iceberg, I think, and I'm sure others on the panel have a lot to say on this too. So I'm going to shut up.
Thanks, Thomas. Drew, do you have anything to add? Why has it been slow to uptake in Australia, nature prescriptions?
Well, I think it's like many public health things, is that people who know why it's so good can't understand why people who don't understand that do what they do. So I think there's a very strong role for social marketing here. And I'll give you an analogy here. We have a project that we did recently about increasing physical activity in people for whom physical inactivity was a problem. We actually went to organisations and said, you're probably responsible for providing 5,000 steps a day. So what are you doing as an organisation to ensure that people are having 5,000 steps a day? Because otherwise, inactivity is a workplace health and safety hazard. So it's that notion of incidental change. So the people who read Nudge will understand this really well. I think what we have to do is it has to be cool to go outside. So I'm going to advocate for Taylor Swift to model that behaviour at a ridiculous level. But in the same way that smoking was changed in the 80s, it used to be in the movies that anybody who smoked was cool and then only the villains smoked. So I think that whole social marketing and saying this is a product and an attitude that we have to change and approach this from a social marketing perspective, not if only people knew they'd do the right thing, because people don't. So that clear-eyedness about it, I think, is going to be a really important process to understand and approach this as a social marketing exercise.
Thanks, Drew. And what's the role of the environment sector in progressing nature prescriptions? Do they have a role, or should the health sector be taking the lead role? Jo?
Oh yeah, it's a bit tit for tat. It's both, but from a park manager's perspective, I mean, our primary role as park managers is to manage our green and blue spaces. So in Victoria, that's 3,200 parks and reserves and over 70% of our coastline. So it's a big job. We're the setting provider as well for a lot of these activities. And I think the environment sector have a role to play in terms of being a proactive partner and enabling these activities with the communities around parks, their visitors and the health sector. But we have a role to play in that marketing campaign that you're talking about, Drew, which is the environment sector need to continue to provide the health sector with information about the value of parks and nature and the benefits of contact with nature and the opportunities around nature prescriptions. So that we have a very strong role to play in that area, working with people like Thomas, and I can see Claire Henderson-Wilson, who I've worked with at Deakin University a lot. So yeah, we also have that role to bring together health practitioners and park managers. I think we can do that and ensure that the appropriate levels of service in these key locations where we're promoting these health nature activities are there. So, you know, we have a program in my team actually to ensure that, you know, a certain amount of our parks are inclusive, they're accessible for people with disabilities, both visual disabilities, neurodiverse disabilities, all sorts of programs going on in that space at the moment. So, I mean, it's a huge role. As park managers, we're park managers, but we can dip into so many different areas.
Thanks, Jo. And from your perspective, Rowena, do you think the environment sector has a role in progressing nature prescriptions, or leave it to the health sector?
I think I'd say, there's a role for collaboration between the sectors. I guess that we in medicine, we're cautious about the medicalisation of issues, when maybe being out in nature should be for everything. It should be part of what community organisations do. But from the clinical world, it's about having those links, knowing our networks of what resources are available locally, and having organisations that might be prepared to take, to have even a phone call from our services or referral to link in a worker. So sometimes that's, they are people, they might be someone with special needs. And again, in the disability sphere, people who are neurodiverse, people who are using wheelchairs, people who have visual issues. And I think an example of that is community gardens. I've been a lot involved in community gardens and bush regeneration for many years. And community gardens, I was involved in one for people with cancer, and it was flat, and it was, it was easily accessible. But so I think it is about also organisations being able to be ready for people who might have, say, for example, mental health issues. One of the things I think, it's actually from being involved in community organisations myself, when you're on a management committee and you have new volunteers or new participants who you clearly have a serious mental health problem, it's about working out ways to be welcoming, working out ways to involve people as well. But I think certainly those for some people, some specific care workers and support and linkage is really important. But for most people, I think a verbal recommendation and easy referral pathways into programs of their preference is really good. And I think parkrun is a really great example. A lot of GPs are aware of parkrun. A lot of nurses would be, telling people to come in with who are maybe not as active as they could be, or maybe a diabetic and need to really work those five sessions of exercise into their week. It's about, but you can refer someone quite easily to that. It's a low cost. It's normally one close to home. It's about finding what's suitable for that person.
Okay, thanks, Rowena. Jose, are there any questions from the audience?
There is one. Is the outdoor Aussie stereotype an issue here? So perhaps a myth, when so many are not actually spending time in nature. So who wants to answer that one?
I might answer that. I think it's interesting because there is a shift, and look, some of them is larger system issues, that we have cities that where there's more and more development, there's less and less green space, there's more and more roads, people are trapped in their cars for much longer times, and people are also on their screens, they're on their phone, they're on Netflix. So I think there has been a cultural change in the last 20 or 30 years, probably in many countries. And actually, even looking at the literature, places like India and China, possibly more so than Australia, people are really, so I think it's happening everywhere. But I think it's, we are losing green spaces as well to development. So, and it's important to note that as well.
Okay, Drew.
It comes back to that really interesting idea of what does it mean to be in nature. And I think this notion that I'm going on an expedition comes back to this Australian being the outdoorsy person and those kind of things. It can just be walking 3 extra bus stops instead of getting off the bus at the normal bus. So I think we have to create the ideas for people about how they can experience the benefits of being in nature, whether that's nature itself or a proxy for other things, by giving them options and ways to do this. And that's really challenging, because when you go and talk to people, time poverty is by far the biggest issue that people have today. And they go, love to, Drew, just don't have time, I'm picking up the kids, or what, all of those kind of things that people get caught up into. So if we look at the research on increasing physical activity in communities, it shows that incidental mechanisms are really effective. in my building, when I was the boss there, I turned the lift off. It was fabulous. They're all healthy people. So people had to walk up the stairs. On the other hand, I tried to swap car parks with a company up the road. So people had to work 500 metres up the road and then 500 metres back every night. And I had a revolution on my hands. So, but this idea of how do we create, what is it that constitutes being in nature and making it what I would call snack size, not 3 weeks expedition into the Cooper Creek or that kind of thing. And I think at the moment we have these ideas of ourselves as Australians which trap us in the sense that nature has to be expeditionary.
Thanks, Drew. Okay, Thomas, have you got a quick thing you wanted to say there before we start to
Quick
close?
thing. What I would normally do in my lectures to undergrads and postgrads here is say, put your hands up if you've been to Singapore. And actually, quite a lot of people would put their hands up so they would know what I'm about to say. In Singapore, because it's been designed that all the buildings are immersed within nature, you've got parks halfway up buildings, you've got big green walls and everything. It's a city where you cannot really be disconnected from the great outdoors, from being in nature, just from sitting in your office or taking a walk to the cafe. You're always in nature. So I think that there's something that we can actually learn from overseas here. One is, yes, we can try and promote and encourage and enable more people to get out into nature. But number two, we can try and actually create cities and redesign our cities where it brings the nature to us as well. I think if we do both, we'll stand a good chance of fighting this.
Thanks, Thomas. Just to close, the panel are going to have 2 minutes each. And the question is, what does the ideal nature prescription program look like in Australia? Who are the leaders, drivers and enablers? And what needs to happen to progress them in Australia? We'll start with you, Drew.
I'm going to say, stop talking to experts and go and talk to the customers and ask them what they want. So it has to be community driven, bottom up and those kind of things. And as ironic as this sounds, having a bunch of experts sitting around telling people what to do, we saw what happened in mental health with that. So I'm just going to leave it at that.
Thomas.
It's the right nature prescription is the one that works for the individuals, the intended beneficiaries. We are in the PANDA trial co-designing what nature prescriptions might look like with those intended beneficiaries and the health professionals who we hope will be recommending them, and the individuals who make it their daily bread and butter to actually help deliver them. So it's exactly as Drew said, we get everyone involved to make sure it works. One final thing is, I'm not sure that, I don't see if you can see this, no you can't, that was my ghastly mobile phone. Evidence is showing that if you spend time out in nature with a mobile phone, it's pretty much a waste of a break. You don't get the same psychological returns on investment. So I would say the ideal nature prescription is without your phone as well.
Thanks, Thomas. Rowena.
Thank you. Yeah, look, I think we're waiting to hear from consumers. I think as part of PANDA, we'll be talking to service providers as well as clinicians to work out what people think should happen. And certainly Robin's, the work of Green Adelaide, we really looked at quite closely as well. So look, I think it's great to have a knowledge among health professionals, nurses, occupational therapists, psychologists. There's a role, there's a role for all sorts of programs within all those sectors. Early childhood nurses, palliative care nurses, all those people can, can get for the community members who are coming to them, think about linkages through. So I think things like the link workers, there's evidence from overseas that makes it easier, especially for people with high needs who probably aren't going to get round to it themselves. I think, online registers of local activities that are suitable, but also preparing local community organisations for not just taking the average person to come to their program in community garden or a bushwalking group, but to actually think, okay, what about those people with special needs, and being able to take them and host them and welcome them in as well. So it's about, I guess, more knowledge about it. And again, I think those bigger structural things of more green space out there. So we need to maintain and protect our space. I think like I said, some of those activities actually build our space, like bush regeneration, community gardening. You're not just out in nature, you're actually building nature as well.
Thank you. And Jo.
Yeah, thanks, Robin. Look, I think that people who need nature prescriptions most need support, guidance, and some structure around that. So very much like the Active in Nature program that we're running here in Victoria with Vic Health. But I like Drew's, ground up, kind of on the ground activities. But I think a multifaceted approach is probably going to be the most feasible. So whilst you're getting runs on the board and having great programs out in parks and getting people to interact with nature in a variety of ways with a variety of nature, be it small little parks to rivers and beaches to bigger parks, I think there is a role for government in this to take some leadership around, policy development that will help build a framework. So I'm going to put it out there: a nature in all policies policy. That government, they do it with some health issues, but every policy that's developed has to consider nature in some way, so that it builds that advocacy across sectors. So let's build a business case around that and the consumer, what the consumer or the patients or the participants need.
Thanks, Jo. Well, this brings us to the close. So I'd like to thank everybody for coming today, and to thank the great panel we've got here representing all the different sectors, which was really great. If people want more information, we haven't been able to answer all the questions. Jose is going to put up our email addresses. So just hang fire there. If you missed the start of this webinar, then it has been recorded and it's going to be available on the Nature for All website. And just a reminder that the Nature for All Love Fest is going until the 14th of February, and they invite people to share their stories on social media and share to NFA hashtag. So there are the email addresses there, and thanks everybody for such a great discussion.
Thanks for doing a good job, Robin.
Have a great day. Thank you.
Thank you.
Yeah.